interface to mucous membrane, the skin in the respiratory tract. So it's a transition zone that you have to know, the vestibule. And if we come further, deeper inside the nasal cavity, you can see these three large folds here. There's a superior, middle, and inferior nasal concha or turbinate, whichever name you like best, concha or turbinate. And if we follow the nasal cavity back behind these turbinates, you can see where it narrows again. Can everybody see where it narrows? And there's a narrow exit to the nasal cavity right here called the internal nair. The internal nair. Now that's an important landmark because when we cross, as soon as air crosses the internal nair, now we're into the throat. The throat extends all the way up here and connects to your nasal cavity. There are three segments to the throat that you guys have to know. The first segment is called the nasopharynx. The nasopharynx extends from the internal nair right there down to the uvula right here. So that space right there is all nasopharynx. Nasopharynx. And in the nasopharynx, we can see right here, the probe is pointing right at it, that is the pharyngeal tonsil. When it's infected and swollen, it's called the adenoid, the pharyngeal tonsil. You can also see a slit right there. It's kind of dark. That is the opening to your eustachian tube or auditory tube, right there. That's where it connects to your throat. Now if we come past the soft palate and uvula, from the uvula to the hyoid bone, here to here is the oropharynx. Oropharynx. And in the oropharynx, we have right here, I'm pointing at it, the tip of the probe is pointing at it, that is the lingual tonsil. That's the second of three tonsils you guys have to know. Right there, if I can keep the probe on it, that is the palatine tonsil. That's the third tonsil you guys have to know. The palatine tonsil. Now from the hyoid bone down to the cricoid, that is laryngopharynx. You can see it contains, here is the epiglottis, and here's the larynx. So this is all laryngopharynx. It's the third part of the throat. So the throat is a pretty big structure. And once we get to the cricoid bone, then we're not in the throat anymore. Now we're into the esophagus, right here, the esophagus. And I think this space right here is the oral cavity. And I think that's all